Hello everyone, welcome to season 2 of ziRight Girls. We hope you missed us because we definitely missed you. I am Dr. Tembelise Masina. I'm an obstetrician gynecologist. I'm with my co-host.
I'm Dr. Talia Isaacs and I'm also an obstetrician and gynecologist. And we are so excited to be back!
Yay!
I missed you, Fred! Did you have a good break?
I did, and you?
I'm glad. Yeah. I'm like 50 shades darker.
Oh.
But yes, I had a good break. So, Lise, what are we talking about today?
So today we're talking about STIs, sexually transmitted infections.
Okay. Ooh, okay. That's a deep topic.
It is, I think in February, it's Sexually Transmitted Infections Month, Awareness Month.
Mm-hmm.
So we just want to bring that to the forefront. We're going to highlight what kind of infections are sexually transmitted infections, what to look out for, when should you be worried, the potential complications of STIs, and yeah, we're just going to handle that. Okay, so Talia, can you just walk us through the definition of what are sexually transmitted infections?
So basically, Lise, like it's in the name, right? Sexually transmitted infections. So these are like infections that you pick up during sexual activity. I have to explain or stress that sexual activity is not always penetrative sex, right?
Yes.
So any like sexual contact, so that can be like oral contact, it can be oral perineal contact, it can be sex organ to sex organ contact. Also, anyone who's engaging in sexual activities is susceptible or is at risk of catching an STI. So this is heterosexual and homosexual couples as well. So we're all at risk equally so. There are different kinds. So we can maybe talk about like the different kinds of viruses and bacteria and also parasites and protozoa. Yeah.
All right. So yeah, like Thalia has mentioned, there's different kinds of STIs. So the common viral sexually transmitted infections, I'm sure we all know this one, herpes, which generally gives you like ulcers. So the ulcers can occur in your mouth, they can occur in your genitals. There's different kinds of herpes viruses. So if you have a painful ulcer or lesion on your genital area, it is very important to check it out because it may be herpes. And also herpes can lay dormant in your body and it can last a lifetime. There's also human papilloma virus.
Yes.
Maybe tell us about human papilloma virus as an STI.
So we've touched on HPV before, and I think you'll never see a gynae without HPV somehow creeping into the conversation. So human papillomavirus or HPV, they are responsible for genital warts. They have different strains. So they are some that cause warts. So you get those little cauliflower lesions, and you have different strains that can lead to cervical cancer or skin cancers in the genital area. Again, this is a very like clever virus. It doesn't require penetrative sex. It's a skin to skin contact virus. So simply like heavy petting, vagina to vagina, like rubbing, penile to vulval rubbing, simple like skin to skin contact can cause the virus to be contracted. The important thing is, this is why we do screening.
Yeah.
We do screening, so you have your pap smears regularly. We're now doing it with co-testing, so you guys can go back to episode 2 of season 1 if you aren't familiar with the pap smear testing and co-testing. Again, I just also want to make it very, very clear that if you are a homosexual female or a lesbian and you've had previous intercourse with a male, or even if you're sharing sex toys, that too puts you at risk of contracting HPV. So just because you're not having heterosexual sex doesn't mean that you should not be testing like your Bacterial and your HPV coating status.
Yeah, and the other thing is HPV can remain in your body for a long time, and you've also briefly mentioned that it is responsible for genital warts, some vulvovaginal cancers as well as cervical cancer. But also to note, this can also lead to laryngeal warts or
Yes.
warts in your voice box, I think. Yes. Also for the males, penile cancer as well as anorectal cancers as well can result from chronic HPV infection. So HPV is important for both genders, and we do have a vaccine for it. So both genders are actually encouraged, especially the young ones before their sexual debut, because you're actually preventing the long-term consequences of HPV infection.
Yeah.
Okay, another virus that we may not necessarily think about it as a sexually transmitted infection is hepatitis. So specifically hepatitis B. Hepatitis B and C, they are bloodborne or can be spread via mucosal surfaces, so they can be sexually transmitted. So hepatitis generally would stay in your liver and cause infection of your liver, or a viral infection of your liver. Can end up long-term infection, can also lead to chronic liver disease, liver failure. It may even end up causing liver cirrhosis as well as liver cancer. Another important thing about hepatitis B is that we can vaccinate for it. So the vaccines are available, I think, in
it's part of
the extended immunization program for the children.
All healthcare workers. Remember when we were in second year, I remember all those trips down to Mowbray to get, so if you
should actually still be getting it regularly.
We should be getting our booster shots, so all healthcare workers. And I would also encourage people who are in the sex industry. So if you are in porn or you are a sex worker, it's also a very good idea to get vaccinated for both HPV as well as hepatitis B. And then the big one.
And we mustn't forget IV drug users as well. So obviously people may not be open about IV drug use, but unfortunately most of the time it's associated with sharing of unclean needles. So if you are infected, you may not be obviously or visibly infected, and unfortunately that's how infections spread, because you cannot tell who has a virus or a bloodborne disease or a sexually transmitted infection before you get it.
And then the big one, I think that everyone knows about, is HIV.
Definitely.
Human immunodeficiency virus. So unfortunately, like this, we're still in the development of treatments, and there isn't a vaccine yet readily available for HIV. But I must say, like, we've come a long way, Lishe. We have come a long way. I remember, like,
there's been great progress in the management of HIV infection. However, we're still getting new infections in young people, which is still very concerning, because with all the education programs that we've had, you remember the APCs? Abstain, be faithful, and condomize. So that was the basis of the campaigns that we grew up with in our era in the early 2000s.
I remember the TAC, the beetroot and African potato. One of the things that hurts me the most is like the loss of Freddie Mercury. Like I think of Freddie Mercury a lot when I see HIV patients doing so well. Like you can't tell. I'm sure some of them have better CD4 counts than me. And then I think of, like, if only we had these drugs back then, we would still be living with legends.
So we come from an era where HIV was like a terminal life sentence to now HIV being a chronic infection which just needs medicine to be managed for a lifetime, and people are really living well and fruitful lives with HIV. but it is still a lifelong infection that we do not have a cure for, and untreated HIV still leads to AIDS, which is acquired immunodeficiency disease syndrome, which can manifest in also many different ways. So AIDS can affect your brain, your skin, your lungs, your liver, and because you're just generally immunosuppressed, you are very vulnerable to all other infections, even simple flu. I work in Mitchell's Plain, and it's still so, TB is still so prevalent in this area. So again, people that are immunosuppressed, they are quite vulnerable to acquiring such infections as well.
Okay, so Lisa, not like all STIs are viral. Some of them are bacteria, and some of them are what we call protozoals or parasites, or like we'll just call it other, right? So the typical ones are, I'm sure most people will know about, is gonorrhea, which causes like a discharge. We also have things like chlamydia, and the other big one that we talk about a lot is syphilis. So in our line of work, syphilis is quite like important for us. We always test our patients. I know it sounds weird. I always say this, but like if you're pregnant, you've had unprotected sex.
And everybody knows too.
I mean, you could have had IVF, but like the presumption, right? So we're always testing for STIs, and those are the things that we will be testing for. So syphilis can cause a lot of like morbidity to both like pregnant moms and their unborn child, but even to adults as well. Syphilis can, like HIV, affect different organs. So it's not always that you're going to have a problem in your genital area. We've seen people become psychotic. We've seen people become demented. People have become paralyzed from something as simple as syphilis. The good news, guys, is there's treatment. So we're going to talk about that a little bit later, but there is treatment for it. Gonorrhea as well, there's treatment, and chlamydia. We're going to maybe talk about how these things how you would suspect it and when to present, and then we'll talk about like some long-term effects and treatment as well. Okay. Lisa, let's do a scenario. Okay, so what are the things that like a patient would come to you complaining about that would make you suspect that this might be an STI?
Okay, so I briefly mentioned about with the herpes, that's generally a painful genital ulcer, but actually all new genital ulcers must be examined and tested for, because syphilis presents with painless ulcers. So again, these ulcers may be obvious or visible, or they may even be hidden. But if you have a new ulcer, it's very important that you do go to your doctor and get tested for sexually transmitted infections, because like we've mentioned, they can have a long-term or chronic consequences, so if left untreated.
So an ulcer, for those who don't know, is just an open sore, right? And like Lisa said, some of these ulcers are painful. So typically, like with herpes, you'll have a painful ulcer. So that one is easy for you to recognize because you'll have like pain. But syphilis typically doesn't have pain. So when you're washing and when you're like feeling around it, like, okay, this is something new. And that's what we mean when we say when there's a new ulcer. Okay, so now the patient has an ulcer and she's presenting to you, and then again, based on what accompanying symptoms, you would decide, okay, this looks like it possibly would be herpes, or it might be syphilis. Okay.
So you can also do some blood tests to confirm these sexually transmitted infections. You can do urine test. You can also swab the lesion so that the can be looked under a microscope to make sure that you're treating the correct thing. And you do have treatment for syphilis. You do have treatment for Haemophilus. You do have treatment for herpes. Although sometimes the herpes will remain dormant in your body for a long time, even if it is treated.
Okay. So then
the other big one is a vaginal discharge or a penile discharge. So
So we've been preaching for the longest time, and for the subscribers, we've been saying that a vaginal discharge is normal, but there are times when it's not, right? So the typical features of a not or an abnormal discharge is obviously if it's got a foul smell. Usually your typical discharge, like your physiological discharge, is a clear colored, odorless discharge, and it's not in copious or it's not a lot, but if you're having a discharge that is increasing in volume, that has a new smell, that is abnormal, especially if it's foul smelling, if it's changing color as well. So green is not normal, yellow is not normal, and like a bloody brown discharge is also concerning and needs to be checked out. Okay, so
but also to remember, not all vaginal discharges are from sexually transmitted infections.
Yes.
So maybe we can just speak about bacterial vaginosis and candida, which are quite common in females.
So those are considered abnormal but not sexually transmitted, right? So bacterial vaginosis, in your vagina, you have bacteria and you also have, let's call them yeasts, right? And they are supposed to live harmoniously in a balance. By washing inside your vagina with harsh soaps, you can change the pH balance in your vagina, thereby overthrowing the balance. And you get like a grayish, watery, looking discharge with a very fishy odor. That's bacterial vaginosis. It just means that the environment in your vagina has changed, and so you've overthrown the balance. It can also be caused by wearing tight clothing and having a sweaty environment, and then it's not sexually transmitted, but having increased amounts of intercourse can also cause it.
Because semen is alkaline, so semen again throws the pH balance of your genital tract. So that is the reason. And so also, that's why we advise maybe cleaning or washing after intercourse to just reset.
Antibiotics as well. Sometimes as doctors, by trying to do good, we might be the cause of it as well. So if you're having a urinary tract infection or you're taking antibiotics for an infection somewhere else in your body, like in your chest, your throat, it can also throw the balance there. So that's bacterial vaginosis. It is not a sexually transmitted infection, but it needs to be taken care of. The other big one, and we see a lot of it in pregnancy, is candidiasis, also known as Candida or thrush is the other colloquial term that we use for that. And again, it also comes down to similar pathophysiology, where there's an imbalance. Now you've got an increase of your yeast.
Again, another thing is, I think when people see a discharge, they always attribute it to maybe poor hygiene, and then they start going wild with the washing and the douching and the soaps and scented things to try and get rid of the smell. But that only makes the situation worse. Yeah, so we were talking about things that increase the likelihood of getting thrush.
So pregnancy, we know, we've spoken again about pregnancy before, but pregnancy decreases your immune system because your body is trying to protect your baby. By doing that, it allows, again, for an imbalance in the vagina. It also makes us think that we should be looking for other chronic conditions that might be making you immunocompromised. So things like diabetes, whether it is diagnosed or undiagnosed, if you have candida, it's a good idea to also just make sure that you're not diabetic and be screened for that. Things that could be immunosuppressing you is medications again. If you're taking steroids for an autoimmune disease, if you're taking chemotherapy, those things can also cause candida. Scrubbing and washing as well can cause candida. And my absolute favorite is chronic wearing of panty liners, guys.
And bubble baths. I am not a fan of bubble baths. Because of all the soap and the salt and, yes, it's nice once in a while to relax in a bubble bath, but
not every day.
It washes away everything and definitely does change the pH balance in your genital tract.
But let's get back to STIs.
Yeah.
Okay, so my patient now comes and she's got this new discharge, right? So unlike an ulcer where you like have pain or no pain, like it's difficult to like ascertain like which organism is causing the discharge. There might be one, there might be more than one. So as you said, we can have a look at it. We're obviously going to do a speculum examination to rule out that there isn't a lesion or a foreign body or a cancer that is causing this discharge. We can do high vaginal swabs, but in South Africa, especially in the state, because all of these things cost money and we want to be as cost effective as possible, we do what we call syndromic therapy. So we cover all our bases, right? So when you have a vaginal discharge or penile discharge, we're going to give you like a basket of antibiotics that we hope are going to cover all the different
most likely organisms and like all of them, basically.
Yeah. So you might get some antibiotics, you might get some injections as well, but the plan is that we want to cover everything.
Okay. Yeah, because some discharges are, we call it pathognomonic, or they're very typical. Like if it's a thick, white cottage cheese like discharge, you don't have to get the whole basket of antibiotics. So that's typical. But obviously sometimes, like you said, there's like multiple infections at once. So the fishy or watery discharge can be
it could be BV,
it could be anything.
It could be chlamydia.
It could be chlamydia, it could be bacterial vaginosis, so you need to cover it with more than one antibiotic.
Yeah. So Lishe, is having an STI just like, it's just embarrassing, right? But are there any other things that I should be worried about if I have an STI?
Actually, Thalia, so I think we must take embarrassment out of it. Yes, obviously we must address that sexual promiscuity, or having intercourse with multiple partners can cause STIs. But it's very important that if you see something that you are not familiar with in terms of your genital health, like we mentioned, ulcers or discharges, that you get it checked out, because these can have long-term consequences, and some of them can be quite serious. Like we've mentioned that HPV can lead to cancers. We've mentioned that you can get multiple organ affectation from other bacteria like syphilis. So it's quite important, because you can end up with very serious complications from sexually transmitted infection. So more than being embarrassed, we want to create an environment where you should feel free, when you are not sure of what is happening with your body, to get it checked out, because these can have long-term consequences.
Okay.
And also your partner must also get assessed and checked out and treated as well.
I think that is also very important, because we focus on the patient that's in front of us, not always like realizing that if you get treated and you go back and have intercourse again with the same partner who wasn't treated, you're just going to reinfect yourself.
Yes.
And in the cases of HIV as well, if you're having untreated HIV, they sort of become like superbugs by being spread between partners.
Yeah.
So that brings me to the question of prevention, right? So we're never going to get around having sex. Like, it's going to be with us as long as
the rest of our lives,
as long
if
as
we want to continue to human existence.
Exactly. It is a human necessity to procreate. So we're not getting away from that. But how can we do it in a way that is safe, so that we prevent things like blindness, psychosis, paralysis, cancers? Let's talk about prevention.
Okay. So again, we're going back to our ABCs. So for the younger people, I think it's quite important to speak about the message of abstaining until you actually meet your life partner, the person that you plan to spend the rest of your life with. If you are older, again, before you engage in sexual activities, get screened and tested with your partner, so that you both know what you are dealing with. So obviously sometimes things you get frisky before all these spontaneous. So condoms are a very important way of preventing sexually transmitted infections.
I love the color.
We have multiple flavors that our president granted us. That's a great flavor. So these are male condoms. They're quite easy to use.
Yep.
And there's also female condoms. Unfortunately, those are very
Tricky.
rare as well to find, even in the places where we should be able to pick up free condoms.
Yeah.
But definitely condoms to prevent contact by penetration.
Yeah. So we've also spoken about like vaccinations. So definitely, as we've spoken about like young, both male and female children before sexual debut, it is a good idea to have them vaccinated against hepatitis as well as HPV.
Mm-hmm.
We've spoken about abstinence, which is not always possible for everyone. We've spoken about informed consent, so you can have conversation with your partner. It is a good idea to have like an HIV test before your sexual debut or when you're changing a partner, because the reality is that we don't always stay with the same partner for our entire lives.
And hepatitis, because we need to either boost, especially if you're working in high risk environment like we do.
We are.
But if you do happen to meet somebody that has hepatitis, then you need to boost yourself and prevent infection.
Yes. And then, like we've spoken about HIV, condomizing, and there's also things like PrEP and PEP. So
Yes.
PrEP stands for
Pre-exposure.
Pre-exposure prophylaxis. So that means you take the medication before you have sexual intercourse.
Yeah.
And PEP is for post-exposure prophylaxis. So we use that in our field of work quite often.
Mm-hmm.
So if you have a needle stick injury, you have a splash in your eye, or you've had like risky unprotected intercourse, you would use a course of antivirals for 28 days. If you've been sexually assaulted, that's the other scenario where we would also consider prevention of all STIs. So yeah, we would give you some PEP and emergency contraception in that instance.
Yeah, and we were talking about how far we have come along in terms of managing HIV. So I was quite impressed. I think about a year or two ago, they launched a 6-monthly injection, which is basically PrEP. So especially those with discordant relationships. So if your partner is positive and you are negative, you can actually get this injection just once in 6 months. And you remain HIV negative. The aim is to remain HIV negative, but there's also tablets, a daily tablet that you can take, and most partners do remain negative, because if the partner takes the medication well and they're suppressed, and you're also taking your PrEP, then there's good outcomes with that.
That's important also for patients who are, like you say, discordant, meaning one is positive, the other is negative, who are planning a baby.
Yes.
Because again, you have to have unprotected
intercourse. Yeah.
Okay.
Yeah, that brings us to the end of this episode.
It was interesting, Lihle. I think it was a very fun topic to talk about with you. It's also a very important topic, and I hope that we've made it like comfortable to have these conversations. Remember, guys, as your gynecologist, we are just here to help you with whatever issues you have. So please don't feel embarrassed or shy. The more information you give us, the better we are able to assist you.
And again, I think an important take-home message is that because some of these sexually transmitted infections can remain in your body for such a long time, so when we pick up a certain infection, it does not necessarily automatically mean that your partner is now cheating, because we find ourselves having to now figure out, when was I infected? We most of the time cannot tell when a person was infected with certain things like HPV, but it is important that when it is picked up, then it is communicated and measures are taken to prevent and treat whatever is available.
Alright guys, there you have it. This week we spoke about sexually transmitted infections or STIs. We know it's not an easy topic to talk about, and we hope that we've demystified it and destigmatized it to a certain extent. Next week on ziRight Girls, we are back and we are going to be talking about myth busting, all about pregnancy. So guys, please like, share, subscribe, and leave your comments. We would love to answer your questions. So if you have any question that you want to ask us, like what is normal, what is abnormal in your pregnancy, you're having symptoms that you're not quite sure about, drop it in our comment section. We will be answering those questions right here on ziRight Girls next week. Until we see you guys next time, we hope that you are
ziRight Girls.